Hello and welcome. Today, we're going to talk about something really important, pneumonia. Whether you've heard about it before or not, understanding pneumonia can help you protect yourself and your loved ones. Pneumonia is a serious infection that affects one or both lungs. It happens when tiny air sacs in the lungs, called alveoli, fill up with fluid or pus. This makes it much harder for your body to get the oxygen it needs and can cause symptoms like coughing, fever, and trouble breathing. The infection is most often caused by bacteria, viruses, or sometimes even fungi. Each type can affect people differently, and knowing the cause helps doctors choose the best treatment. While anyone can get pneumonia, some people are at higher risk. Young children, older adults, and those with chronic illnesses or weakened immune systems need to be especially careful, as pneumonia can be more dangerous for them. Learning the basics about pneumonia is the first step. It helps you recognize symptoms early, seek medical help quickly, and understand what to expect during recovery. The good news is, with the right treatment and care, most people recover completely from pneumonia. Support from healthcare professionals and loved ones makes a big difference. So let's get started and learn how to recognize, prevent, and manage pneumonia together. Are you ready? Let's dive in and empower ourselves with knowledge. How do you know if you have pneumonia? It can be tricky because the symptoms often look like those of a bad cold or the flu, but there are some warning signs you can watch for that set pneumonia apart. Common symptoms include a persistent cough, which may bring up colored or even bloody phlegm, high fever, chills that make you shiver, feeling extremely tired, and shortness of breath that can make even simple activities feel exhausting. Chest pain that gets worse when you take a deep breath, or cough, is another important clue. This pain can feel sharp or stabbing, and it might make it hard to breathe deeply. In older adults, pneumonia can sometimes show up in less obvious ways, like confusion, memory problems, or feeling unusually weak, even if they don't have a fever. If you or someone you care for notices these symptoms, especially if they get worse quickly, it's important to see a doctor as soon as possible. Doctors will listen to your lungs for crackling or bubbling sounds, which can signal infection. They may also order a chest x-ray to look for signs of pneumonia, or run blood tests to check for infection in your body. Sometimes your doctor might ask for a sample of your phlegm to test in the lab. This helps them find out exactly which germ is causing your illness, so they can choose the best treatment. Getting diagnosed early means you can start treatment sooner, which often leads to a faster and smoother recovery. It also helps prevent complications. Don't ignore severe, sudden, or unusual symptoms, especially trouble breathing, chest pain, or confusion. Acting quickly can make all the difference. Most pneumonia cases can be treated at home. If it's bacterial, you'll get antibiotics. Finish the whole course. Rest, stay hydrated, and use over-the-counter medicine for fever or aches. A humidifier or steamy shower can help you breathe easier. Recovery takes time. Cough and tiredness may last weeks. Listen to your body and don't rush back to normal activities. Follow your doctor's advice for a smooth recovery. Pneumonia can sometimes become very serious, and in those cases, hospital care is essential to ensure the best possible outcome. Recognizing when to seek urgent medical attention can make a big difference in your recovery. Head to the hospital if you experience severe difficulty breathing, ongoing confusion, a very high or unusually low temperature, or notice bluish lips or nails. These are signs that your body isn't getting enough oxygen and needs immediate help. Infants, older adults, and people with chronic health conditions like heart or lung disease are especially vulnerable to complications from pneumonia. For them, symptoms can worsen quickly, so it's important to act fast. In the hospital, you may receive treatments such as IV antibiotics, supplemental oxygen, and continuous monitoring to help your body fight the infection and recover safely. If you're ever unsure or worried about your symptoms, don't hesitate to call for help or go to the hospital. It's always better to be safe and get checked by professionals. Acting quickly can truly save lives. Remember, your health and well-being should always come first. Never delay seeking care when you need it. Prevention is key. Get your flu shot and ask your doctor about the pneumococcal vaccine. Wash your hands often and avoid smoking to protect your lungs. Eat well, exercise, and keep your immune system strong. Recognize symptoms early and seek help when needed. Most people recover fully with the right care. Stay informed, stay healthy, and look after each other.